Breast cancer is one of the most prevalent and widely studied types of cancer globally. It primarily affects women, but can also occur in men. This multifaceted guide aims to provide comprehensive insights into breast cancer, encompassing its definition, standard treatments, seriousness compared to other cancers, prognosis for different stages, promising therapeutics, challenges, types, FDA-approved medications, and valuable resources for those navigating breast cancer. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101 Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. What is breast cancer? Breast cancer is a malignant disease characterized by the uncontrolled growth of abnormal cells in the breast tissue. It can develop in different parts of the breast, such as the milk ducts, ductal carcinoma, or the milk-producing lobules, lobular carcinoma. Breast cancer can manifest in various forms, from non-invasive tumors that remain confined to their original location to invasive types that infiltrate nearby tissues and potentially metastasize to other parts of the body. Standard of care treatments for breast cancer. The standard treatments for breast cancer depend on factors like the cancer's type, stage, hormone receptor status, and the patient's overall health. Common treatment options include surgical procedures such as lumpectomy, removal of the tumor and some surrounding tissue, or mastectomy, removal of the entire breast, aim to eliminate the cancerous tissue. Radiation therapy. This treatment employs high-energy rays to target and destroy cancer cells, typically following surgery to reduce the risk of local recurrence. The use of radiation and surgery together against a small breast tumor is commonly known as a lumpectomy. Chemotherapy involves the use of drugs to kill or slow the growth of cancer cells and is used for systemic treatment when cancer has spread beyond the breast. Hormone therapy. Hormone receptor-positive breast cancers are sensitive to hormones like estrogen or progesterone. Hormone therapy drugs, such as tamoxifen or aromatase inhibitors, can block these hormones to hinder cancer growth. Targeted therapies. These medications, such as Herceptin, specifically target proteins on the surface of cancer cells and are effective for HER2-positive breast cancers. Immunotherapy. Some immunotherapies, like Keytruda, are explored in clinical trials to enhance the immune system's response against breast cancer cells. Seriousness. Compared to other cancers, breast cancer is one of the most common cancers worldwide and affects millions of individuals each year. Its seriousness can vary widely depending on various factors. Generally, breast cancer is considered to have a more favorable prognosis when detected and treated early compared to some other cancers. The 5-year survival rate for breast cancer is around 90%, making it one of the more treatable cancers. Prognosis for Stage 1. Breast cancer stage. 1 breast cancer indicates that the cancer is localized to the breast and has not spread to nearby lymph nodes or distant organs. The prognosis for Stage 1 breast cancer is generally excellent. With appropriate treatment, including surgery and potentially radiation therapy or hormone therapy, the 5-year survival rate can be over 95%. Prognosis for Stage 4. Breast cancer stage. 4 breast cancer, also known as metastatic or advanced breast cancer, indicates that the cancer has spread to distant organs or tissues. The prognosis for Stage 4 breast cancer is less favorable, with a lower 5-year survival rate, typically ranging from 22% to 27%. However, treatments can help manage the disease, control symptoms, and extend survival. Triple-negative breast cancer is the most challenging type of breast cancer to treat, with stage 4 cancer patients having a 5-year survival rate of 11 to 25%. Promising therapeutics for breast cancer. Ongoing research is exploring promising therapeutics to improve outcomes for breast cancer patients. Some areas of interest include targeted therapies. Researchers are investigating new targeted therapies that specifically target genetic mutations and molecular pathways involved in breast cancer growth. PARP inhibitors, for instance, are being explored for BRCA mutations. Immunotherapies. Immunotherapies, including checkpoint inhibitors and CAR T-cell therapies, are being studied for their potential to enhance the immune system's ability to recognize and attack breast cancer cells. Precision medicine. Advances in precision medicine enable personalized treatment approaches based on the unique genetic characteristics of a patient's tumor. This may lead to more effective treatments with fewer side effects. One place to research promising breast cancer clinical trials is onclive.com. One integrative treatment that is promising for hormone-positive breast cancer patients is molecular iodine. In a human trial with 120 breast cancer patients, the addition of molecular iodine, which is not the same as the common supplement potassium iodine, doubled the complete response rate, the complete eradication of cancer from the body, when added into standard of care treatment. This study and many others are described in the book Cancer Self-Defense 101: Quick Tips to Help You Survive. Why is breast cancer tricky? Breast cancer presents several complexities, making it a challenging cancer to manage. Heterogeneity breast cancer is not a single disease. It encompasses various subtypes with distinct characteristics and responses to treatment. Tailoring treatment to the specific subtype is essential for optimal outcomes. Late diagnosis breast cancer may not cause noticeable symptoms in its early stages, leading to delayed diagnosis. Regular breast self-exams, mammograms, and clinical screenings are crucial for early detection. Risk factors. Breast cancer risk factors can vary among individuals, making it challenging to predict who will develop the disease. Recurrence. Even after successful treatment, breast cancer can recur, necessitating long-term surveillance and follow-up care. Types of breast cancer and their impact on prognosis and treatment. Breast cancer can be categorized into several types based on various factors, including where it starts, its growth patterns, and the presence of specific receptors. Here are some common types of breast cancer and how they impact prognosis and treatment. Ductal carcinoma. In situ DCIS. DCIS is a non-invasive cancer where abnormal cells are found in the lining of a breast duct. The prognosis is generally excellent, as it has not invaded nearby tissues. Treatment often involves surgery. Invasive ductal carcinoma, IDC, is the most common type of invasive breast cancer originating in the milk ducts. The prognosis varies depending on the stage, with early-stage IDC having a better outlook. Treatment may involve surgery, radiation, chemotherapy, and targeted therapies. Invasive lobular carcinoma, ILC, begins in the milk-producing lobules. It tends to be less common, but may be treated similarly to IDC, with a focus on surgery, radiation, and hormone therapy. Triple-negative breast cancer. This subtype lacks estrogen receptors, progesterone receptors, and HER2/NUU overexpression. It can be more aggressive and may require chemotherapy as a primary treatment. HER2-positive breast cancer. HER2-positive breast cancer overexpresses the HER2 protein. Targeted therapies like Herceptin are effective against this subtype. Hormone receptor positive, HR+, breast cancer. This subtype has receptors for estrogen and/or progesterone. Hormone therapy is often a key part of treatment. BRCA mutations. Individuals with BRCA gene mutations have an increased risk of developing breast cancer. Targeted therapies, such as PARP inhibitors, are being explored for these cases. The risk of breast cancer is reduced by 4.3% for every 12 months of breastfeeding. This is in addition to the 7.0% decrease in risk observed for each birth. FDA-approved medications for breast cancer. Several FDA-approved medications are used to treat various types of breast cancer. Some examples include hormone therapy, tamoxifen, anastrozole, and letrozole. Targeted therapies, trastuzumab, pertuzumab, lapatinib, and neratinib. Chemotherapy, paclitaxel, docetaxel, doxorubicin, and cyclophosphamide. Immunotherapy atezolizumab is approved for specific cases of metastatic triple-negative breast cancer. Keytruda is also approved for hormone-positive breast cancer. PARP inhibitors, olaparib and talazoparib, for BRCA-mutated breast cancer. Organizations and resources for breast cancer treatment. For individuals and families seeking support and information related to breast cancer treatment, the following organizations and resources can be invaluable. Susan G. Komen, for the Cure. This organization offers extensive information, resources, and support services for breast cancer patients and their families. breastcancer.org, an informative website that provides a wealth of resources, including articles, forums, and expert guidance. Living Beyond Breast Cancer, LBBC offers support, information, and educational resources for individuals affected by breast cancer. National Breast Cancer Foundation, NBCF, offers early detection education, patient navigation services, and resources for breast cancer patients. Breast Cancer Action, advocates for policies and practices that address the root causes of breast cancer and provide resources for individuals navigating the disease. Young Survival Coalition, YSC, focuses on providing support and resources for young women diagnosed with breast cancer. A note about mammograms. Mammograms are not recommended for anyone under 45 by the American Cancer Society. Once a year between 45 and 54, above 54 is every other year. Many people think mammograms do more harm than good. 72% of breast cancers are found by women doing self-examination. It's important for individuals diagnosed with breast cancer to discuss treatment options, including potential side effects and benefits, with their healthcare team. Decisions should be based on the specific characteristics of the cancer, the patient's overall health, and individual preferences. Early detection through regular checkups and screenings can significantly improve the prognosis for breast cancer. For more information, see the book Cancer Self-Defense 101.